Welcome to the Virtual Shift, a show looking at the seismic changes happening in healthcare with virtual care at the epicenter. Join me and my guests as we look at key cultural and policy shifts impacting how providers, payers, and patients connect, as well as how care is being reimagined both for today and the future. Hello, and thanks for tuning in today. I'm your host, Tom Foley. You can learn more about this show by visiting the program on healthcarenowradio.com, and be sure to follow me on LinkedIn, Twitter at FoleyTom, and the hashtag The Virtual Shift. Today we have on our program Christian Milaster. He is the founder and president of Ingenium Digital Health Advisor. Christian, welcome to the program.
Thank you, Tom, for having me. Really great to be here.
Awesome. So, Christian, you host Telehealth Tuesday newsletter, and I know that's available through your website, and you just told me it through LinkedIn. So you had some very interesting posts as of late, and I thought you would be a great subject matter expert to come on to the program and further educate the listeners on your thoughts on the strategy of telehealth. And I might extend that to make sure that it's just not the video visit we're talking about. It's really about the virtual care adoption extending into remote patient monitoring, chronic care management, and remote therapeutic monitoring for that matter. So I have a couple of your posts here, measuring telehealth success. Right, we get some I'll call it drama in some of the press that says telehealth was great, telehealth is now not working, right? And but we all know telehealth through COVID validated itself in a very viable and valuable tool to deliver care. Your thoughts?
My thoughts is that telehealth is here to stay. I mean, the cat is out of the bag, the toothpaste is out of the tube, right? So it's not going back. As we all know, those of us who are in the telehealth world, telehealth has been around since the mid-1990s in full earnest. It started in the 60s, and it has been demonstrated viability. But I think the adoption rate was just so low because of a number of technical challenges early on, and then a number of reimbursement challenges later too. But yes, once those barriers were removed and there was a necessity for clinicians to use telehealth and telemedicine, they used it and they could still provide really decent and good care. But ultimately, it's about how do we actually measure success and what does success mean? And a lot of healthcare organizations that we work with or that we get introduced to are not measuring the operational performances of their processes or their services. I remember 20 years ago, working at the Mayo Clinic, a surgeon being really irate that nobody could tell him how many surgeries he performed or how much equipment he used in the last surgery, but what was the cost of the gauzes and all the other things. So healthcare, I think, has a very dismal track record compared to other industries to really measuring the efficiency and effectiveness of their services. Outcomes notwithstanding, that's a whole other realm, and there's research going on. But just the operational process measures and outcome and output measures, that is something that I think is really, really important to really demonstrate whether your telemedicine service is successful or not.
You have a very interesting quadrants that define success: input, output, quality, and outcomes. Can you walk us through that?
Yeah, well, actually, the key 5 measures of telemedicine success that I focus on are 5, and it's patient satisfaction, physician satisfaction. Those are outcomes measures, because if the patients enjoy the experience, if a physician says, yeah, this was as good as inpatient care, which is one question we asked in the satisfaction survey, those are the first 2. The other one is just volume and modality. So these are more output measures, right? How many visits did you do? Was it video? Was it audio? Was it RPM? Right? To your point earlier, that telehealth is really more than just video visits. And then the other 2 is, were there any technical issues? And then did we get paid for it? Right? That's something to keep track on, especially now that the public health emergency is ending in July 2022, and we've got another 150-day extension. But yes, so those are the 5 metrics that I suggest for telehealth success. The matrix that you refer to is a generic measurement matrix, because there's 4 types of measurements. There's input measures. It's what you do in your process. How many physicians did you train? How many webcams did you deploy? How many Zoom licenses do you have? Right. So that's an input measure. Then there's an output measure. That's maybe how many visits did you have and what modality. So that's more an output measure. And the third areas are quality measures, right? So that's how the quality of the service. So that's where patient and physician satisfaction fits in. And then the last one then is the outcomes measures. And those are in healthcare always the hardest to measure because healthcare is complex and the human body is complex and treatment is complex. But when we look at chronic care management, we can look at compliance with monitoring. We can look at A1C values. We can look at blood pressure values. We can look at actually cost evaluation. So if you're coming at it from a payer's perspective, you can look at utilization of emergency rooms and all of that. And we actually just did an analysis on that for one client. So those are the four types of measures, right? Input measures, that's just process. Output, again, that's just mainly process. Those are nice to come by, but they're easy to measure, but they're not really very meaningful. Quality is much more meaningful because that gives you an insight as to how the quality is being perceived and how you can turn the needle towards great quality. And then the fourth one is the outcomes measures, really what we're ultimately after. And that's probably where some of the people who are on the fence about telehealth or against it are questioning whether telehealth can achieve the same outcomes as in-person care. And we can dive deeper on that because I've got some good opinion on that as well.
Yeah, I'm very interested in hearing your opinion on that because I'm a believer that virtual care, telehealth, virtual care, telemedicine, given its title, is the opportunity for providers to extend care into the home. It's not just about what happens in the brick and mortar. As my guests know, I almost every show I rattle off the statistics on the average Medicare patient with 5 chronic conditions. At the end of the day, they see 9 doctors and only in front of their doctors 15 hours in a given year. Question on how you get the value is what happens the other 8,745 hours. I have always espoused that this continuous care model, or let me just say it differently. What virtual care does is allow you to adopt a continuous care model. So therefore, you're adopting telehealth, remote patient monitoring, remote therapeutic monitoring, chronic care management. And a provider can drive a significant amount more revenue because now there's CPT codes and services that they can partner with that can drive a significant amount of revenue, not only in top line, but profitability, right? So the point there being is I sometimes argue, why take on risk when you in a risk scenario? I know that's what value-based care is, but if I can implement a viable and sustainable virtual care model or a continuous delivery of care model, I can engage my patients more frequently. I can monitor them more diligently, and I can get them to a different state of wellness and drive revenue and profitability for myself and not even take on risk. What are your thoughts on that?
Well, let's unravel this.
Disagree, by the way. You can disagree, by the way. You're allowed to.
So, well, I do agree with that. So let's unravel this from the beginning, right? You said at the beginning, just making sure that we're talking about not just video visits, but the bigger scheme. And 10 years ago, when I started Ingenium, I started out with building first off a taxonomy because I needed to have real clear definitions in my mind of what telehealth and telemedicine and virtual care and connected health, what does this all mean, and digital health. And so for me, telehealth is delivering care at a distance, right? Period. And then telemedicine is a subset of telehealth to practice medicine at a distance. So that's when a clinician interacts with the patient either synchronously through video visits or through a phone call, as we've demonstrated, also being a feasible modality. It's better than no visit at all, so at least the phone, but also asynchronously through text messages or through video messages or education, right? And then obviously we have the whole remote patient monitoring or remote physiological monitoring area. And then the third area of telemedicine is store and forward, right? The ability to fax an EKG, which is telemedicine, but also to record a picture of a mole and send it to a dermatologist for evaluation. So that's the whole landscape of telehealth. The next level up, and you just mentioned that, is connected health. For me, the best definition I could find, and my kudos go out to Dr. Joe Caveda, who's been very instrumental in the last years, is that it is about empowering wellness, right? You mentioned wellness, right? Our goal in healthcare should be to empower patients to be well and to get well and to stay well in the most convenient way. I mean, that is the ultimate vision, I think, that we need to pursue. But we get so caught up in rules and regulations and reimbursement and all of that. But ultimately, any patient should have access to care when they need it, where they need it, what they need. Any clinician should not worry about sending 5 text messages and then having a 3-minute video visits and then having a 2-minute phone call if that is what the patient needs at this time in their care journey, in their wellness journey, right? So it's all these rules, and that's why physicians are so upset about the EMR and the EHR and all those rules and regulations. Now they're still operating in this environment because you can't change it because it is so conflicted. But that's my passion. My passion, the mission statement of Ingenium is to enable the delivery of extraordinary care. And it's not about technology, it's about workflows and processes and ultimately giving physicians the tool to do their job that they went to school for 15, 20 years to before they finally can fulfill their mission. So yeah, that's where I'm coming from. So I'm in total agreement here with what you said.
Yeah, I couldn't agree with you more, Christian. At the end of the day, we have not only the need to, in using your words, empower wellness, but on the flip side of the equation, even before we get into, even before COVID, we had these dynamics, these macro trends, older, ager, sicker population, right? Contracting more and more, developing more and more chronic conditions, less doctors and nurses, right? That is, to me, the fundamental challenge of the day is how do you take care of an older, growing, aging, sicker population with less doctors and nurses? There's a different formula here. It's not staying on the hamster trail relative to what we used to do in the brick and mortar. And what COVID taught us minimally is virtual care works. It has value. And remote patient monitoring and chronic care management has value. And you can make money at it because, you know as well as I, physicians are shy relative to engaging new efforts if they're not going to get compensated for it. Right? We all want the same thing, but we're not a charity. No one is a charity, right? So what are your thoughts on that? How do the reshaping, the reimagination of the delivery of care? Your thoughts?
Well, I think as I just talked about, right, it takes 15 years for a physician to be educated and to be trained, and they're basically heads down, just doing learning what it takes to be a clinician in their chosen specialty. And by the time they wake up, they miss basically 15 years of real life because they've been so heads down. And so it's hard for clinicians to change. The biggest resistance that I've seen and diagnosed, so to speak, on physicians is because they don't want to look like a fool. They don't want to do something that they're uncomfortable with. It's not so much about money. Again, there was an AMA survey came out in 2019 about the top 5 concerns about telehealth. And one of the reasons, can we get paid? Can we get reimbursed? Yeah, of course, that's on physicians' minds and especially on solo practices or physician entrepreneurs. That's on their mind. But the majority, 95%, they don't care about the money. They care about being able to do good care delivery. And being on camera, staring into the lens is like a fish out of water. You can't touch, you can't do anything. And so, and virtually nobody was trained on using telehealth. They said, here's a Zoom license and here's a webcam, go do a telehealth, right? So go do telehealth, here's some video software and go do telehealth. That's really where it was going, but nobody got trained. It's like, what are your website manners? How do you do telehealth effectively? How do you do a remote diagnosis? How do you physical exam, right? I just attended a session of a clinician who walked us through how to do a physical exam, and it's absolutely feasible and doable.
And I think that's exactly the problem, right?
Right.
I think a lot of physicians are still on the COVID bandwagon of using FaceTime and Zoom, with all due respect to the folks at Zoom, but they don't have scale into virtual care. Again,
right.
Remote patient monitoring, therapeutic monitoring, chronic care management. These are all extensions and modules within a virtual care portfolio and all of what is necessary to provide that continuous care model. So right. I think they got comfortable with telehealth, rightfully so. It kept them engaged. That's good. All right. But, now that, we're coming out of COVID, in some states, there's seemingly a rise taking place. Right. But nonetheless, it is, the reinvention of the delivery of care. And again, it's really the adoption. You also, in your writings, you talk about the 7 levels of telehealth maturity, which I found very interesting. I'll just go through them real quick, but if you can walk us through it, that would be great. Level 0, chaotic, emerging. Up to level 2, coordinated, supported, integrated, strategic, transformative. Level 6 was transformative. Talk us through how a provider can engage in a model where I'll just transform your level 6 into a crawl, walk, run scenario, right? Talk to us a little bit more about how you engage your clients on this maturity model.
Well, you actually took the words right off my mouth because, the origin of that was the crawl, walk, run analogy, right? It was the idea that you cannot jump into being highly transformative with telehealth if you are not even covering the basics. Now, that may excite some technologists to do some cool stuff, or maybe even excite a leader or even a clinician to do it. But there are some basic steps that you got to be taken care of. And so as we've worked with organizations, I've worked with organizations for 15 years, starting at the Mayo Clinic before I launched into my own consultancy. And I just discovered that different telehealth programs are just at different levels of maturity. Some it's just all chaotic, and that's where a lot of organizations were at that did not do telehealth before COVID. Those who did, like some big health centers, I mean, they went up. There's a health center in New York State, right, Northwell, I think, 10,000 telehealth visits a week. And they scaled very quickly because they had some expertise and they could grow it. I was working with an FQHC in rural Vermont on March 17th, St. Patty's Day in 2020, right? The kind of turning point, at least for me. And we set up telehealth by the end of the week for 5 primary care offices, including 25 clinicians, and then grew that volume back to 80% of pre-COVID. But it was seen by many as a stopgap measure. And so really the maturity model came about because helping organizations to figure out where am I at, what are the things that I'm not yet doing that are the best practices of what people do, and then gradually move from here to there. And so we have an assessment tool that we've developed across that. It's available on my website, ingeniumdigitalhealth.com, self-assessment tool across 10 different dimensions, including like leadership engagement and governance and technology and support and marketing. So these different aspects, and then back comes a definition of what those maturity levels are. And it gives you an idea of what you need to do before you can move to the next level.
Would it be fair to say that if a provider is on a phone with a platform provider and the first part of the conversation is about price, that they should be looking elsewhere for a partner? I only say that because so often I'm in sales, right? I'm responsible for growth at GDMD. And, and I often tell my clients I really don't sell, because at the end of the day, it's really about the consultancy, the things that you do. If you got to take the solution off the table, got to understand the problem. If you understand the problem, you can put a roadmap together on how to get from a starting point and work your way through those 7 levels of success. I'm trying to educate the provider. What should they hear? What should they be listening to when they're engaging on, something that's going to be successful for them at the end of the day?
Well, actually, I have a 9-step process. I'm an engineer. I'm a German engineer, and so I love to create systems, processes, and actually, so to your point here, if a physician or anybody in healthcare is talking to a vendor and talk about pricing first rather than about the usability and the workflows and the feature set, or doesn't even know what questions to ask other than what's your fee, that means that means they're first buying the horse. So they're putting the horse behind the cart. And I know the American idiom is, or the English idiom is the other way around, putting the cart before the horse. But what I mean by that is that most organizations first buy a horse, and then they look around and say, okay, what cart do we want to pull? And so what I teach my clients is you got to figure out what are your workflows, what are your features, what are you looking for, what are you trying to accomplish, what are you trying to achieve now, and also in a few years, right? So once people are making it through that transformation of becoming either at the strategic level or the transformative level, the top two levels of that maturity model. What do you want to leverage telehealth for? And pick a platform provider, pick a solution that can grow with you. A lot of it, 90% of success is not in the technology. 90% of the success is in the workflow. You can have even clunky technology, make it work with good training, good support, good workflow design. It becomes much easier, and you have a richer feature set if you use one of the more modern telemedicine platforms that have been developed specifically for the purpose of supporting care at a distance. But you got to figure out first, what are your requirements? Again, as an engineer, that's where we start with. We rarely start designing a solution. We start with first figuring out, well, what does it need to do?
I couldn't agree more. So, as we talk about crawl, walk, run, and moving across your 7 levels, it is really, I always talk about starting modularly, right? Start with a feature function. Start with telehealth. Forget about remote patient monitoring. But know that when you're doing telehealth, you have the ability to scale to remote patient monitoring. Then know that you have the ability to scale to remote therapeutic monitoring, and then so forth down into the continuum, right? Not only can you scale in the terms of modules, but you can also scale in terms of chronic disease conditions. Start with your hypertensive, move to diabetes, move to respiratory, right? So you can scale across that. That to me is some of the dynamics that health systems need to look at, and even payers for that matter, need to look at as they look to adopt call it a Gen 2 virtual care platform, because it's those degrees of scalability that really make a big difference to a provider's success. Your thoughts?
Yes. Yeah, absolutely. So it's you got to really figure out what is your strategy, what's your roadmap, where do you want to go, and you got to start small. Right, a lot of organizations are starting too big, and then they get the backlash. And so what I have learned over the years is you got to start with what I call the proof of concept, and the goal of the proof of concept is to validate assumptions, and that's a step that 90% of people miss. Is they don't become present to the assumptions that you've made in the design of the solution and the design of the workflow, in the selection of the technology. Right? One basic assumption is clinicians will like it. Right? I mean, that should be an assumption that you're making. When we had the transition into the EHR, nobody made that assumption. And we're still, I'm saying I'm doing penance for the sins committed by EHR vendors onto healthcare. So because I'm still reeling the effect of poor solutions and poor technology standing in the way between the clinician and the patient. So yeah, you've got to first figure out what you need, and then do a proof of concept. Start small. Start with one clinical condition. Start with a handful of clinicians. Start with one site, work out the kinks of the workflow, customize your technology solution the way that it fits your workflows, your culture, your clinician's mindset, and then scale from there. You'll be in the long run much more successful. This is not a race. You got to take it slow. Healthcare, as you said earlier, does not change very, very rapidly. It's very conservative, rightfully so, because every single day clinicians have to make life-affecting or health-affecting decisions. We should not take that lightly when we come up from the outside, from technology or sales. It's hard to understand, and I'm grateful for my introduction to healthcare at the Mayo Clinic, where I really learned about excellent patient care and the commitment to the needs of the patient. But that's where we got to start. And that's, I think, the biggest mistake is also to not include clinicians in the whole process. Ultimately, this is a clinical tool. Telehealth is not a technology. Telehealth is not a workflow. It's not a way to get paid. It's not a way. It's a clinical tool. Just like a clinician is deciding, is it an X-ray or an MRI or a CT scan that I need? A clinician should have the freedom to choose, do I engage this patient in their wellness journey through in-person visit, through telehealth visit, through asynchronous texting, through a phone call, through messages on the patient portal, right? How do I help this patient? And so giving physicians this range of tools so that they can engage patients to take part in the other 8,000 hours of the year, right? That is really that's why I'm focused on enabling the delivery of extraordinary care. That's really what is needed. And that is a shift. That is a mindset shift that needs to occur from the leadership perspective, but also from the clinician perspective. And I think that'll take a generational shift. I think the young physicians that are coming in now that have experienced COVID, especially in any part of their journey, they will embrace and they will push for the use of all the different avenues so they can help their patients to be well, to get well, and to stay well.
I couldn't agree more. At the end of the day, this is not about adopting technology. It's about adopting a tool. Well said. And at the end of the day as well, this is really about, I've always said, in healthcare, you got to get it right. And it still disturbs me to this day, if I might reflect a bit on your EHR comments, because I went through those wars as well. The fact that we can still not 100% match patient records is a difficulty to understand. 13 from 2010 to now, so 9-10. But anyway, great discussion, Christian. I think you are spot on, and I am excited for your clients, frankly, to hear you speak, because again, I think you're just nailing it relative to understanding what this market is, what it isn't, and most importantly, let's not replicate our flaws of EHR adoption as we move forward into this next generation of tools that are about delivery of care more so on a 24/7 basis versus what happens in the office. I'll give you the last word. We have about 30 seconds left.
I just, in summary, thank you so very much for being here. Yes, there's a virtual shift that is happening. We need to kind of reimagine the delivery of care, as I just laid out, right? We got to give the physicians the tool so they can do what they think is the best way to engage the patients. Telehealth, telemedicine, connected health is a clinical tool, and we need to treat it as such, involve the clinicians, and give them all the support we can so that they can practice on top of the license, that they spend 8 hours of their day doing only the things that only a physician can do. All the other stuff, we need to be there for them to take care of. And with that shift, we will create beautiful patient outcomes. We will have an opportunity to engage patients, to empower them, really. It's empowered wellness, which is the ultimate goal, with information and support and help. And I'm excited about what's in store, and hopefully we'll not take another COVID crisis to push things forward. But we are in an exciting time in healthcare, and the next generation of physicians is standing by to take this all the way home.
Awesome. Christian Milaster, founder and president of Ingenium Digital Health Advisor. Thanks again for joining the program.
Thank you, Tom, for having me.
I want to thank the show sponsors. HP Engage Long Lifecycle Products provides the stability, safety, and security you need, plus flexibility and performance designed for today and tomorrow. As well, GenieMD, providing a modular, scalable, and customizable virtual care platform and clinical services to help providers extend care into the home, increasing access and quality while driving new revenue opportunities. If you missed part of today's episode, you can tune in at the same time, 11 a.m. or 7 p.m. Eastern, throughout the week, and be sure to check out the program page on healthcarenowradio.com. And remember, connect or follow me on LinkedIn, Twitter at FoleyTom, and follow the show's hashtag, The Virtual Shift. I'm Tom Foley. Until the next shift.